Have you ever wondered what it means when nothing comes out during climax? This can be a confusing and sometimes worrying experience for many men, especially as they age. The ejaculation process naturally changes over time, and understanding these changes is important for your sexual health. While it's common to notice differences in ejaculate volume as you get older, knowing what's normal and what might need attention can help you maintain confidence and seek appropriate care when necessary. Let's look at the science behind what's happening. Ejaculation occurs when muscles contract to release semen through the urethra. When little or no fluid comes out during orgasm, several things could be happening in your body. The most common cause is retrograde ejaculation, where semen flows backward into the bladder instead of forward out of the penis. This happens when the bladder neck muscles don't close properly during climax, creating a reverse path for semen. Several factors can lead to retrograde ejaculation. Certain medications for high blood pressure, enlarged prostate, or mood disorders may relax the bladder neck muscles too much. Medical conditions like diabetes can damage the nerves controlling these muscles. Previous surgeries involving the prostate, bladder, or urethra might also affect normal ejaculation pathways. While retrograde ejaculation doesn't cause pain or reduce pleasure, it can be surprising when you notice the change. Another possible reason for reduced ejaculate is simply lower semen production. Your body naturally produces less semen as you age, particularly after 50. Hormone changes, specifically decreasing testosterone levels, can reduce the volume of fluid. The good news is that while volume decreases, this doesn't necessarily mean reduced sexual function or satisfaction. It's simply a natural part of aging that many men experience. Frequent ejaculation can also temporarily reduce your fluid volume. If you climax multiple times within a short period, your body may not have enough time to replenish semen stores. This is completely normal and temporary. Your body needs about 24 to 48 hours to restore typical ejaculate volumes after frequent sexual activity. This isn't cause for concern unless you consistently notice very little or no ejaculate, even with longer intervals between sexual activities. Hydration levels play a big role in semen volume and consistency. When you don't drink enough water, your body conserves fluids, making semen thicker and reducing its volume. This is why you might notice less fluid when you're dehydrated. On the flip side, staying well hydrated helps maintain normal semen production. Try to drink at least 8 glasses of water daily to support healthy ejaculate volume. Your diet also affects what comes out during climax. Zinc is especially important for semen production. This mineral is found in foods like oysters, beef, pumpkin seeds, and beans. Not getting enough zinc can lead to lower semen volume. Other nutrients matter too. Proteins, vitamins C and D, and folic acid all help make healthy semen. Eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins supports better ejaculate volume and quality. Heat exposure to the testicles can reduce sperm and semen production. The testicles need to stay slightly cooler than body temperature to work properly. Things like hot baths, saunas, laptop heat, or even tight underwear can raise scrotal temperature and temporarily decrease semen volume. Giving your body time to cool down and recover can help return ejaculate volume to normal levels. Some men experience dry orgasms, where they feel pleasure, but release very little or no fluid. This can happen after certain medical treatments or surgeries. Prostate surgery, radiation therapy, or removal of the seminal vesicles, which produce most of the fluid in semen, can cause this condition. While dry orgasms still feel pleasurable, the lack of fluid can be surprising if you're not expecting it. Have you noticed changes in your ejaculate after starting new medications? Some medicines can affect ejaculation. Blood pressure medications, antidepressants, and prostate drugs are common culprits. Alpha blockers used for prostate problems often cause retrograde ejaculation as a side effect. Certain antidepressants may delay ejaculation or reduce the volume that comes out. If you suspect your medication is causing changes, talk with your doctor before stopping any prescribed drugs. Blockages in the ejaculatory ducts can prevent semen from coming out properly. These blockages might be caused by infection, inflammation, injury, or even small cysts. When ducts are blocked, semen has nowhere to go during climax, resulting in little to no fluid being released. This is different from retrograde ejaculation because the semen isn't going into the bladder, it's simply being stopped from moving through the reproductive tract at all. Low testosterone levels can cause both reduced sex drive and lower semen volume. Testosterone is the main male hormone responsible for sexual function and sperm production. As men get older, testosterone naturally drops by about 1% each year after age 30. This gradual decrease explains why many older men notice less fluid during ejaculation. Other signs of low testosterone include feeling tired, losing muscle mass, having trouble getting erections, and mood changes. A simple blood test can check testosterone levels if you think this might be your issue. Some men worry that having less ejaculate means they're less fertile or less manly. This simply isn't true. The amount of fluid that comes out doesn't directly relate to how masculine you are or how well your body works. Remember that most of semen is made up of fluids from the prostate and seminal vesicles, not sperm. Sperm makes up less than 5% of semen volume. Even with lower ejaculate amounts, you might still have normal sperm counts. Quality matters more than quantity when it comes to fertility. Did you know that stress can affect your ejaculate volume? When you're under a lot of stress, your body produces more cortisol and less testosterone. This hormone shift can reduce semen production. Stress also affects blood flow to the reproductive organs, which can impact ejaculation. Finding ways to manage stress through exercise, meditation, or talking about problems can help improve sexual function, including ejaculate volume. A common myth is that ejaculating less fluid is always a sign of a serious health problem. While sometimes reduced ejaculate can signal health issues, often it's a normal variation or age-related change. Another misconception is that you need to save up for weeks to increase volume. While waiting a day or two between ejaculations can increase volume, saving up for very long periods doesn't necessarily lead to much more fluid and might even reduce sexual satisfaction. What are your thoughts on this? Comment below so we can explore topics that matter to you on the next videos. Some people believe supplements can dramatically increase ejaculate volume. The truth is more complicated. While some nutrients like zinc, L-arginine, and lecithin might help support normal fluid production, no pill will cause dramatic increases in volume. Many male enhancement products make big promises but have little scientific backing. Good overall health practices like proper hydration, balanced nutrition, regular exercise, and stress management are more likely to help maintain healthy ejaculate volumes than any single supplement. Another wrong idea is that having less ejaculate means less pleasure. Orgasm intensity depends on many factors beyond fluid volume. The strength of muscle contractions, nerve sensitivity, and psychological factors all play bigger roles in sexual satisfaction than how much fluid comes out. When should you be worried about having little or no ejaculate? If the change happens suddenly rather than gradually, it might need checking. Sudden changes in bodily functions often signal that something needs attention. Also, if you have other symptoms along with reduced ejaculate, like pain during climax, blood in urine, fever, or trouble urinating, these combination of signs suggest you should see a doctor soon. These additional symptoms might point to infection, inflammation, or other health issues that need treatment. Men who have recently had surgery, especially prostate, bladder, or spinal surgeries, should expect changes in ejaculation. These procedures often affect the nerves and muscles involved in normal ejaculation. If you've had such surgeries, the change in ejaculate is likely related to the procedure. Your surgeon should have mentioned this possible side effect, but if they didn't or you have questions, following up with your doctor is a good idea. Certain health conditions make changes in ejaculation more likely. Diabetes can damage nerves controlling ejaculation over time. Multiple sclerosis affects nerve function throughout the body, including sexual function. Enlarged prostate, a common condition in older men, can block normal semen flow. Spinal cord injuries may interrupt the nerve signals needed for normal ejaculation. If you have any of these conditions and notice ejaculation changes, telling your doctor helps them manage your overall care better. Some medications are known to affect ejaculation. Alpha blockers for high blood pressure or prostate problems often cause retrograde ejaculation as a side effect. Some antidepressants, for instance, can delay ejaculation or reduce semen volume. Certain antipsychotic medications may also affect sexual function. Never stop taking prescribed medication because of sexual side effects without talking to your doctor first. Often, adjusting the dose or switching to a different medication can help. Are you taking several medications? Drug interactions can sometimes cause unexpected sexual side effects. If you see multiple doctors, make sure each one knows all the medications you take. This helps avoid unwanted interactions that might affect ejaculation or other body functions. If you're trying to father a child and notice reduced ejaculate, it's worth getting checked sooner rather than later. While ejaculate volume doesn't directly relate to fertility, some causes of reduced ejaculate can affect sperm health or delivery. Retrograde ejaculation, for example, means sperm are going into the bladder instead of out of the body, where they could fertilize an egg. A fertility specialist can offer specific tests and treatments to help with conception if that's your goal. So what can you do if you're experiencing reduced ejaculate volume? First, make simple lifestyle changes that might help. Drink more water throughout the day to stay well hydrated. This simple step alone can improve semen consistency and volume. Pay attention to your diet, adding foods rich in zinc like seafood, meat, beans, and seeds. Also include fruits, vegetables, and whole grains for overall reproductive health. Getting regular exercise improves blood flow throughout your body, including to reproductive organs, which can help with sexual function. Manage stress in healthy ways. High stress levels affect hormone balance and can reduce semen production. Find activities that help you relax, whether it's walking, listening to music, reading, or spending time with friends and family. Getting enough sleep is also important for hormone balance and overall health, including sexual function. Most adults need 7 to 9 hours of sleep each night for best health. Avoid things that might harm testicular function. Limit time in very hot environments like saunas and hot tubs. Don't keep laptops directly on your lap for long periods. Wear looser-fitting underwear if you tend to run hot in the groin area. These small changes help keep testicles at their ideal temperature for sperm and fluid production. If you're concerned about medication side effects, talk with your doctor. Never stop taking prescribed medication on your own, but do discuss your concerns. Often, there are alternative medications with fewer sexual side effects. Your doctor might adjust your dosage or recommend taking medication at a different time of day to reduce impacts on sexual function. For retrograde ejaculation, simple treatments might help. Your doctor might prescribe medications that strengthen the bladder neck muscles to prevent backward flow of semen. These include certain antihistamines, decongestants, or tricyclic antidepressants used specifically for this purpose. Remember that some decrease in ejaculate volume is a normal part of aging. Just as hair grays and skin develops wrinkles, reproductive function also changes over time. What matters most is whether you're experiencing discomfort, pain, or significant distress from these changes. Most importantly, don't hesitate to talk with a healthcare provider about your concerns. Many men feel embarrassed discussing sexual health, but doctors have heard it all before. Sexual health is simply one aspect of overall health. A good doctor will listen without judgment and help find solutions that work for you. With the right information and care, most ejaculation issues can be understood and often improved, helping you maintain a satisfying sex life at any age. Now tell me, what's one thing you'll do differently after watching this video? Please share with us in the comments. Thank you for watching and see you in the next video.